Hey everyone, welcome back from your discussions. I hope you had wonderful discussions. I know the group I was in, it was so nice to kind of continue with some of those chats we had already had. Before we dive in, I do want to remind you about the game that we have. We have lots of activities you can do, adding to your profile, posting the session. You'll all get points for those. And then at the end, you could get a smile train and swag bag. Could be yours. In keeping with where I think in Arizona we are going to be, my next guest is a place called Tubac, which was first a Spanish garrison outpost and on the Camino Real. So, Spanish outpost is my next guest. And with that, I do want to open our next session, which will be how to empower your kids, building confidence for lasting impact. I'm so excited. I could always use some empowerment, and I really want ways that I can learn to empower my daughter and truly help build those things. So please give a warm welcome to Dr. Leanne Magee, who's going to present to us. Thanks, Leanne.
Hi, everybody. I'm going to wait a second for my slides to come up, but I'm going to be talking today about how to build resilience and empowerment in kids and adults with Cleft. I'm a pediatric psychologist at the Children's Hospital of Philadelphia with the Cleft team there, and I'm drawing on a lot of experience I have over the past 15 years working with our patients and families. So we're going to talk first about some of the psychosocial challenges that kids with Cleft might face. We're going to talk a little bit about 10 hot tips for building resilience. And then we're going to talk about some ways to build confidence using social skills and other types of things that you can practice at home. So if we can, thanks so much. Someone else is driving my slides, so we're going to do our best to be a team today. We know from quite a bit of research among kids with cleft and other craniofacial conditions that while most of our kids are quite resilient, they certainly do face some unique psychosocial challenges. Many of our babies, when they're born, may work through feeding and growth difficulties, speech and language delays, other delays in development, sometimes vision and hearing challenges. As they age into the school years, we might be experiencing some challenges with early learning milestones, as well as some social difficulties as they cope with unwanted attention, questions, comments, and even teasing and bullying about visible differences. And that can translate into some internalized appearance concerns for some of our kiddos. And all through this, they are coping with years of medical and surgical procedures, visits to clinics, and hospitalizations. So that presents a pretty significant psychosocial barrier for a lot of our kids. Because we know that so many systems are involved medically, emotionally, family wise, we really have found the best way to treat a patient with cleft is through multidisciplinary team care. When we think about multidisciplinary team care, this means all of the specialists who work with your kiddos, or you when you were younger, are working together on the same team. And at the center of that team is the patient and the family. Our team at CHOP has plastic surgery and nursing, pediatricians, genetics, audiologists and ENT, speech language pathologists, dentists and orthodontists, social work and psychology. And we're all brought together by our team coordinator who helps all of our families schedule their visits, communicate with their team, and get their care coordinated. Even if they're not from our area, we work really well trying to connect with local providers. As a part of that multidisciplinary team, as the psychologist, I meet with our families once a year or so and conduct a pretty quick and dirty psychosocial assessment. And it's quick because our families are busy on a team day. They're seeing anywhere from 6 to 8 doctors, and it's a long day. And it's often my one chance to check in for the year and see how our kids are doing. So the things that I'm always trying to check on for our families is how does each person in that family understand the child's condition and their treatment? Do they know what they have and what their doctors are talking about? Are they connected to developmental therapies and reaching their milestones as they grow? Are they connected to supports at school and doing their best work with the best team? How is the family doing and coping, and what types of resources might they need? I check in and make sure our kids are connected to friends and activities that they enjoy. And if they're experiencing any difficulties, that we do our best to try to connect them to some supports. I like to make sure that our kids are also being screened for conditions like anxiety, depression, behavior concerns, and that the sooner we can catch those things and get some supports in place, that the better our kids and families can do. I like to ask our families how everyone's feeling about how things related to their cleft are looking and working for them, and make sure that we can have some really nice open conversations about how everyone's thinking and feeling about appearance. And then we talk a ton about dealing with cleft and craniofacial treatments, whether that's dental and orthodontic work, upcoming surgeries, or making decisions about something like a jaw surgery, for instance. Then I partner often with our social worker to see if there are any barriers that our families might be facing that get in the way of them acting supports that they're going to need to thrive, try to overcome those challenges, and provide any needed resources. One of the things that I think is the most essential to keep in mind when we're talking about any child at all, cleft or no cleft, is that a child is the center of a bunch of nested systems. So, this is one of the developmental models that can be used and that we think about in psychology, especially pediatric psychology. But you see that this child is at the center of these different rings, and that includes their family, their school, their peers, their broader community, the geographic location they're in, philosophical and economical things that might be going on around them. And so when we see a kid in our office, what we're actually seeing is the center of like a solar system. And that child is there because of, and sometimes in spite of, the different things that orbit around them. And what we have learned time and time again is that the resilience of an individual depends on drawing resources from a lot of other systems. So our kids can't succeed without the great support of the families, the schools, the medical teams, and communities that they live in. And so we're going to talk quite a bit today about resilience. And I know we talked about empowerment and confidence, but what I think is at the center of that system is learning how to develop resilience. Resilience is the ability to bounce back when something doesn't go your way. The formal definition is that it's the process and outcome of successfully adapting to a difficult or challenging life experience, especially by using mental, emotional, and behavioral flexibility and adjustment to demands that we might be experiencing internally and externally. So that's just really being able to have the grit to go through something hard and get through it and come out on the other side often stronger. Factors that influence resilience can include the ways that we think about the world and connect to the people in it, what type of resources we have access to socially in our community and the quality of those supports, and using specific types of coping strategies that can really help us build our strength. Resilience is really important because when we can cultivate resilience, we can increase our capacity to manage stress, anxiety, and uncertainty, even when we are facing really acutely difficult things. One of the most important things that we know about resilience is that, some people are born a little tougher, but anybody can learn how to be resilient. And the reason why we want to teach resilience is because greater resilience has been associated with being more sensitive and competent, having an improved ability to face life's challenges, being more interested and willing to help others, staying healthier physically and emotionally, feeling happier in our important relationships, being more successful in our school and work, decreasing our risks for things like anxiety and depression when we're going through hard things, and increasing our self confidence. So, resilience in the face of adversity has some amazing long term outcomes. And so, that's why I want to focus today on talking about where we can help build resilience in our kids. Now, resilience comes from a couple of different places. And I mentioned a minute ago, some people are kind of born tough. And I think a lot of our kids with cleft come out ready. They know that they are going to need some strengths internally. And so often, what we have sort of within ourselves, if we're coming from a foundation of resilience, is a lot of internal confidence, an ability to control ourselves, our thoughts, our behaviors, really critical thinking skills, a positive outlook, the capacity to take responsibility for our behaviors and the consequences of the things around us, and using really healthy and effective coping skills. And again, not everyone's born with that, but the great thing is that we can learn those things. Externally, things that help us build resilience, if we could back up just a minute, are access to positive role models, caring relationships, and community resources. And so, CleftCon, we're like checking the box on external resiliency factors today. We build our resilience by practicing behaviors, thoughts, and actions over and over again throughout time. And so we have to think about this not as like a one and done thing, but a continuous process. So every day, every time we face challenges, big and small, we are increasing our capacity to build resilience. One of the most common influences on building resilience is having at least one stable and committed relationship with a supportive adult. This can be a parent or a caregiver, it could be a close family member. But if you are that person in your child's life, know that you are setting them up for success with building their own resilience. Kids who do well in the face of hardship often have a biological resistance to adversity, but what they really need are strong relationships with important adults in their family and in their community. And as adults, we can really help balance the risk factors that our kids with cleft might be facing through those psychosocial, developmental, and medical challenges by helping them build the capacity to feel like they can have a positive influence on the things around them, building their confidence and their ability to cope, and building their adaptive skills and positive outlook on life. The American Psychological Association has studied resilience across populations, and they've come up a bit with 10 tips for helping build resilience with kids. And on the surface, these seem pretty easy. Most of us are doing a lot of these things, but I want to draw some attention to them. So we're going to take a minute to run through each of them. These slides can be available too, so you can refer to them later. But then we're going to talk about some of the social skills that we're going to be building to help put these resiliency skills together. So on the next slide, some of the first things that we can do is building a caring connection and relationship with your child. So you want to maybe be that person in your kid's life who's going to help them develop resilience. You want to offer safety and security, give them some scaffolding, build that support around them as they build their independence, and be very responsive to your child's needs. That means if a kid says they're scared, you're going to say, that sounds really hard. Tell me what's scary, instead of saying, you're not scared. Nothing scary is happening. You want to observe, you want to listen, you want to reflect back the things that they're telling you, and then you want to collaborate and partner with them on problem solving. You want to also be always mindful of giving attention and affection to your kids. You also want to help them make and maintain connections in their community, learning how to be a friend, being empathetic when thinking about others, connecting with others through shared interests, and really building that social support network that's going to be part of your kids' resilience. You want to help them to help others. We know that asking for help can be really difficult, but it's also a sign and source of strength. So you want to teach your kids how to reach out for help, often by modeling that yourself. One of the best ways that we can help kids develop a capacity to want to help is get them to help somebody else. So if they've been through something hard, say, hey, I wonder if you could talk to this person about, learning how to do those monkey bars, because I know that was pretty tricky for you. So when your kids can be helpers, they really get strength from that. We also want to help maintain routines. Often, cleft care and medical care can feel really overwhelming and unpredictable. And when we can have some steady threads through that, it can be a lot of comfort for it to have that structure, especially with younger kids. So you want kids to figure out what are their own routines, whether it's the routine you do when you come to Cleft Clinic, the routine you have when you come to the hospital, or just your regular daily, morning, evening routines. Same time, we need to be flexible and we need to teach kids how to take a break sometimes. We don't want to be so structured and so routine that we're adding to our kids' stress. We want to teach kids that it is okay to take a time out and enjoy ourselves, even when things are really hard. So you want to make sure you're protecting time for play, for rest, and for flexibility. By doing that, what we're doing is teaching our kids self-care. We're letting them know that it is as important as anything else to protect time for themselves to eat, to rest, and to play. We really want to make sure that we're protecting time for kids to have fun. And the best way we can do that is by being a good example, taking care of ourselves, showing our kids how we're taking that time to care for ourselves, and then inviting them to think about the things that they want to do to care for themselves as well. We also want to help kids be mindful of goals. We want these goals to be reasonable, and we want to help kids break them down into smaller steps so that it can feel a little bit easier to make progress and achieve. And we really want to catch those wins along the way. Cleft care can feel like a really never ending road. And when we can say, oh my gosh, we've already done 3 orthodontist visits, we're getting so close. You're doing such a great job. I'm really proud of you because I know this stuff is tough. Those compliments, that recognizing successes is a part that a way that we're nurturing kids' self-confidence and their positive sense of self. We want to reflect on where kids have been, the successes they've had, how they've contributed to helping others, We want to laugh at our mistakes or the parts that are really hard and sometimes a little bit silly. And we really want to teach our kids to trust in their own ability to solve problems and make decisions in the way that's best for them. All of that comes together to help us really foster a positive outlook on life, even when it gets really hard. We want to help kids practice gratitude and appreciation for what they're going through and the people who are helping them through it. We really want to shine a light on them and their strengths and help them see that there is a future beyond the current hard situation that they might be in, even when you're feeling like you're stuck in the middle of that tunnel. We also want to teach our kids strategies for dealing with intense thoughts, feelings, and behaviors in tough situations that can feel overwhelming. Working with a psychologist is one way you might be able to do that. But even at home, you can help your kid practice different strategies like calming strategies for breathing and visualization. You might work on lots of positive affirmations and encouragement. You might help them learn to stop and think before they act. We really want our kids to be critical thinkers. We want to have empathy for what they're thinking and feeling, but gently challenge them if their thinking might be excessively negative, and maybe encourage them to think about another way they might be able to view the situation. And through that all, we're really encouraging our kids' own self discovery, help them see who they are and what they've learned and how they've grown through their challenges. These are some of the tricks and tips that we use in therapy. I'm not going to get into them, but the cognitive model is something I draw on quite a lot to understand how our thoughts, feelings, and behaviors interact in a situation to give us a particular outcome. And the most important thing that I want folks to know about this is that we can be flexible and we can influence how we think, how we feel, and how we behave by learning a little bit about ourselves. I also know that by building our confidence, we can help respond to problems with resilience. And so some of the tips that we're going to move into in these next couple minutes have to do with encouraging confidence. We want to let people know it's okay to make mistakes. We want to build that flexibility. We want to set kids up for success with scaffolding. We want to offer choices and control when we can. And we really want to practice self advocacy and share our strengths with others. We know that folks with appearance differences who have good levels of social skills have been shown to have greater self confidence and be more satisfied with the quality and the quantity of their social interactions and have a better quality of life. So, being prepared by having a strategy to manage stressful social interactions can really help increase positive reactions and interactions with others, and then help people develop a more positive view of themselves. But we need to practice early and we need to practice often. So, I'm going to talk now about a couple of the social skills that I think are so essential for our kids with Cleft to build their own confidence. The first is nonverbal. We don't even have to say anything. This is called steps: self talk, tone of voice, eye contact, posture, and smile. Self talk are the messages that we're going to be giving ourselves or giving our kids. We want them to think positive and affirming statements about themselves. You're so funny. You have a lot of great things to say. So when a kid goes into a stressful situation, we want them to have that as their mental script. We want to practice them having a positive, appropriate tone of voice so that their great ideas can be heard. We want them to maintain eye contact, look at people in the eye. That communicates strength and confidence. We want our kids to stand upright. We don't want them covering their faces or hiding themselves. We want them to bravely show themselves to the world. And we want them to smile. We're communicating friendliness, we're communicating confidence. So before anything even comes out of their mouth, they're coming in, they're feeling strong, their shoulders are back, and they know they have something important to share with the person they're about to talk to. Now, we know that often our kids are going to get asked questions in these social situations that might sometimes catch them off guard. On the next slide, we're going to talk about, I think, one of the most important verbal skills that our kids can have, and that's called rehearse your response. We know that kids are curious. Sometimes people ask well meaning questions. Sometimes it's not so well meaning, but I like everyone to be ready for it. And when we can rehearse that, when we can have a little bit of a one liner or a script ready, we increase our kids' confidence in their capacity to handle that situation effectively. We can practice and tweak it until it feels just right for them. And we can really help them maintain positive control of that social interaction. A successful response is going to have three components. We're going to label what the person has called out as maybe the difference they're noticing. We're going to give a little education and reassurance. And we're going to move things on to talk about or do the things that we really want to do. So it might be like someone says, "Hey, what's that on your face?" And you can say, "Oh, that's a scar. I was born with a cleft lip and palate, but I had a surgery when I was little." Doesn't really bother me anymore. Do you want to go play soccer? And so, if we can practice that, if we can anticipate that, what we're doing is we're giving our kids the tools for a successful social interaction where someone's curious about something that could otherwise have potentially shut them down or made them feel isolated or spotlighted in a way that didn't feel positive to them. We also want to help build resilience and confidence through cleft care. We want to know who our kids are, what their risks are going in, but also what their strengths are. We want to be honest with them about what's going to happen. We want to plan for procedures. I like kids to know what's happening, why we're doing it, what it's going to help with, when is it going to happen, where is it going to happen, how's it going to happen, what am I going to eat and play when I'm recovering. We want to give choices with medical care when we can. Do you want me to sit next to you or do you want to sit on my lap? Do you want to do this side or that side? And so that way, kids are really feeling empowered when they are participating in their cleft care. I want kids to feel like participants, not objects in their medical care. Through medical care, we want to make sure that kids are staying connected. We want to make sure that we're tuning into the needs of the whole family, siblings included, aunts, uncles, cousins, grandparents. Everyone has a stake in the game. And so we really want to make sure that for all of the folks that are involved in surrounding our kids and their support networks, that we're asking for help, we're seeking help, and we're giving help to each other. And your help could potentially also come from your cleft team. So, in review, we know that resilience is success and positive outcomes, even when we're going through hard things. We can increase our sensitivity, our competency, and knowledge. We have an improved ability to face challenges. We want to help other people, and we are often going to feel a lot more self confident when we're resilient. But we must be resilient and practice cultivating that in ourselves in order to help build that in others like our kids. So, you really want to teach, model, and use healthy and effective coping skills. Take care of yourself and your relationships and important connections. Stay organized, but be flexible. Ask for help and have fun. Cleft care does not always have to be the hard stuff. It can be a really amazing part of a kid's journey becoming themselves. And we really hope that on the other side of kind of coming to our cleft team visits, our parents, kids, patients, the whole family can really feel the strength of what they've gotten through together. So I'm happy to move into our Q&A here. I know many people have had lots of experiences with cleft care, raising kids, or maybe being a kid themselves with a cleft. And so I'm going to catch up a minute with the comments and then I'm happy to take some questions. How do you create affirming statements with children that they believe, especially when they already have self confidence issues? This is a great question. So, I think kids can sometimes have challenges with self confidence in one area, but there might be something that they're still really good or really strong at. And so, I don't like to think about confidence as an all or nothing thing. It's sort of like this meter that we can build, it's going to go up and down depending on where we are and who we're with. But every kid has something that they're good at. And often when I am meeting families for the first time or for our annual checkups, I really ask them, like, what's something you're proud of this year? Like, tell me something that you succeeded with. If the kid can't come up with something, I ask the parents to come up. What's three really cool things about Braden? Tell me something he did that really surprised you this year. And so we're modeling confidence by actually like talking good about them. Often, when folks come to a psychologist, they think they're there just to talk about problems. But I think some of the best practice can be talking about the things that are going well. So that's one way that I like to help kind of sneak in some confidence and build up those levels of confidence. Is sometimes we're not going to talk about the cleft. We're going to talk about how great a piano player they are, or that cool marble maze, how creative they are, so that they can really start to have a sense of pride in themselves as a whole person. And, the cleft may or may not be a part of that pride for them at that point. And they may come in and out of that depending on the stage of life that they're in and how they're feeling about things. How do you help a cleft affected child cope in an age appropriate way when a surgery fails? This is tricky. And I think, again, success and failure, I don't like to think about things as super black and white. I let our kids know that our doctors are always doing their best job to help our kids' bodies work better and feel better. And that sometimes when we heal, everything goes super smooth. And sometimes things need a little bit of extra help. So, cultivating that patience, we want to really focus on positivity that the doctors tried really hard to make that work. But we might need to do something like that again in a few years. I know sometimes folks need, like a repeat bone graft or something like that. I really like to make sure that kids know that it is not their fault and it's not even the doctor's fault, that sometimes bodies just do what bodies are going to do. We focus on the things that their body is maybe doing well or the workarounds that we might need for a while their body's not doing so great. But really focus on being positive about maybe even the small changes we can see, or that there's a capacity potentially for things to improve in the future. What healthy coping skills and tactics have you seen in patients at CHOP? I love that our patients at CHOP, I get to see them a lot and I feel really grateful for that relationship. So I start seeing kids in our team like between 3 and 5 years old, and then I'll see them every year until their graduating team, which is sometimes like college age and beyond. One of the things I do right away, even with my like toddlers, is I center them in the care. And so, like, I introduce myself and then I talk to the kid. And I think kids feeling empowered to talk to their doctor and answer questions themselves, even if it's just like, who lives in your family with you? What's a game you like to play? Tell me about a friend at school. They really start to own their cleft care. They see that they belong there and their thoughts and their ideas are important. And so that's something that I see in a lot of our kids is they get pretty comfortable pretty quick with our team. And we do our best to make sure that those visits don't feel stressful, that they feel like a conversation, a check in, a way to learn about them, and then partner with them about their plans. So I think having kids be the center of those visits and conversations, not in a way, again, that they're the object, but they are the primary participant, I think can be a really healthy coping skill for our kids. And I think connecting with others. I always want to make sure that social, introvert, extrovert, my kids are connected to something that brings them joy in their life, whether it's arts and crafts, it's dress up, it's sports, it's academics. I want kids to find that thing that really drives them and gives them a sense of strength. And so I always like to ask my families about, like, what are you doing for fun these days? Like, what's the coolest thing that you're getting into? Because that really helps them connect to something that feels like a source of strength for them. How can we help our young children through the why me stage of our journey? This is a great question. And I think that this is something that comes up for most kids with cleft at some point. The flip side comes up too, where often siblings will say, it's not fair that she always gets to go with you to the hospital. And it's like, wow, that's the other side of this. It can feel like a lot. We don't know why some babies are born with clefts and some babies are not. I really believe that our babies with cleft are strong. They are stronger sometimes than the regular kid. And I let kids know that we don't know why it happens, but we do know that you have everything that you need to get through this, and that this is one of your superpowers. It is something that will sometimes feel really hard, but it's also going to be something that's going to give you amazing strength, amazing skill, and amazing confidence. And so while it can feel sometimes like a burden, it's also a really exciting opportunity. And I think when we can continue to kind of send that message to our kids that it is something that is a part of who they are, it is not defining who they are, but it is one part of the way that they are building up themselves, their strengths, their capacities to cope. I hope that over time, that why me can turn into like kind of like yay me. This is I meet so many older folks with cleft and a lot of my teens. It's so exciting when I hear them say like, oh my gosh, I wouldn't change this for anything if I had a magic wand. I sometimes ask, if they're a not chatty kid, would you ever change anything if you had a magic wand? No one wants to give their cleft up. Once they get through it, once they're on the other side, even through all the hard stuff, it really becomes a source of self-confidence and a source of pride. And so I encourage families to kind of like trust the process and believe the experiences of the people who have walked this path before them. That even though it can feel really hard, it's also an amazing source of strength. What is a healthy intervention dealing with a family when the parent is acting out more anxiety than the cleft affected child? This is a common concern. I have a lot of anxious and worried parents because they care and because they want to do the best all the time for their kids. And so sometimes I will meet with those parents separately, or sometimes I will just talk about, that it's okay to be nervous. Sometimes grown-ups are nervous and anxious too. And I'll just call out that anxiety in the room. I'll say, raise your hand if you're scared about something here. And we'll start to talk about it. And that's where the therapy skills start to come into play, where we can identify what our thoughts and our feelings are, how it might be affecting our behavior, gently challenging those beliefs, seeing if we can get some cognitive flexibility and see if we can problem solve a little bit. And so I can sometimes teach the parents that in a brief session. And it's really cool if the kids get to participate, because often, even if a parent is verbalizing the anxiety, that child's internalizing some of their parents' anxiety too. So I want them to all know that this is okay to talk about and that we can acknowledge it. We don't have to make all the anxiety go away. It's there for a reason. It's there to protect us and to keep us safe, but we don't have to believe all of it. Sometimes there's other ways to think about the situation.
Wow, I just that's my one word for this session. Thank you so much, Dr. McGee. That I took away so much from that. Your steps, acronym, just building resilience, and truly so much from that that can help our community, our kids, our adults. In the spirit of that, be sure to check out Smile Train's new youth school resource, which is titled Every Smile is Special. If you go to the lobby, you can click into the resources bubble and you can find it. Or on the side where you have your chat buttons, you can click into resources at the bottom and it's also there too. This tool is to help cleft affected youth talk to their peers about cleft and other facial differences. It's also offered in both a digital booklet and a PowerPoint format, and it makes it easy to use in the classroom or at home. Truly a great resource. Please check it out. Thank you again, Dr. McGee. I took so much from this, and I hope you all did too. And we'll see you over at the next session.
Thanks so much.
Bye.
Bye.